Sachin Jain, well respected, wrote an article where he said, just stop with the press releases and buy a hospital and see if you can figure it out. Essentially, is what he said.
Yep.
And he said that to the big tech. And now I came back and said, there's not a single big tech company that should give up its 20% profit margins and get into the 4 to 5% profit margins of healthcare and the slog that it is. I mean, from a business model standpoint, but it's an interesting concept to say, could they do things better than healthcare could? If an Amazon or Google or whatever bought a health system, could they do a better job at the consumer experience? Could they do a better job at organizing our hours of labor to address the labor shortage trying to address right now? I mean, are they that much more efficient, or do they have magic sauce, or is it just because their magic sauce is they don't get into the areas that quicksand, essentially?
Yeah, I think that's a really interesting question. My perspective would be that on the consumer experience, absolutely, they could do better. I don't imagine you could do, I mean, in some of the places I've gone, I don't think you could do much worse, right? It's just, it hasn't been a priority. And I think with the pandemic, it was difficult to make it a priority because we were just trying to survive through it, right? With the labor shortage and trying to get through what was happening. It's very difficult. Some organizations have made the bandwidth in order to do that. I think the nice thing is for those organizations that were doing well, they're doing extremely well now financially. So there's cash to be able to make investments, to look at things a little bit differently. But I think as you think about patient experience, the fact that I call into my primary care doc, I told you I've been with her for 19 years. It's like I'm brand new every time I call.